Hi Jim, how's it going? My name's Ava and I'm just here to go over a few lab tests that were ordered for you today and explain what they are and what they mean. Is there anything that you can tell me about liver tests? Okay, that's great. I'm just going to explain a few things and answer any questions that you may have. So the first test is AST, and the normal range for males is about 14 to 20, and this test is used to evaluate liver and heart disease, and some factors that may affect the results are pregnancy and drug use. And some signs of an increased level include weakness, abdominal pain, or jaundice, which is just a yellowing of the skin and eyes. And some signs of a decreased level include muscle weakness, low energy, and difficulty with protein metabolism. And some implications are alcoholic hepatitis and heat stroke or weakness. And just a heads up, before all these tests, I will need to do a blood draw, which is just a simple poke. And after this test, I'm going to review your results and monitor you carefully. The next test is ALT, and the normal range in males is from 10 to 40, and this test is used to diagnose liver disease and monitor the course of treatment for hepatitis. Some factors that can affect the results are drugs and obesity, and some signs of an increased level include jaundice, loss of appetite, and dark-colored urine, and some signs of a decreased level include fatigue, weakness, and signs of nutritional deficiencies. Some implications are heart failure or severe burns, and after the test, you can just resume to your normal activities. The next test is alkaline phosphate, and the normal range for adults is 52 to 142, and this test is used as an index of liver and bone disease. And some factors that can affect the results are fatty meals and when refrigerated. Some signs of an increased level include jaundice, bone pain, and itchy skin. And some signs of a decreased level include numbness, muscle weakness, and in children, growth delays. Some implications are heart failure and diabetes. And before this test, you will need to fast, which is just not eating either a couple hours or a day before, depending on the test. And after this test, you can resume to your normal activities. Next is direct bilirubin, and the normal range for adults is 0 to 0.3, and this is just measuring your bilirubin in your blood. And some factors that can affect the results are when the specimen is exposed to sunlight or has air bubbles. And some signs of an increased level include jaundice, dark-colored urine, and pale or clay-colored stools. And some signs of a decreased level include possible liver dysfunction and mild fatigue, but often there are no obvious symptoms. Some implications are jaundice or cancer of the pancreas, and before this test you will need to fast, if possible, and after the test you can resume to your normal activities. Next is total bilirubin. The normal range for adults is 0.3 to 1, and some factors that can affect the results are prolonged fasting and anorexia, and certain foods such as carrots or yams. Some signs of an increased level include yellowing of the skin, itchy skin, and fatigue, and some signs of a decreased level include low red blood cell count and signs of metabolic issues. And some implications are a variety of anemia and heart failure. And before this test, you will need to fast, and after the test, you can resume to your normal activities. Next is albumin, and the normal range is 3.5 to 5.2. And this test is used to evaluate nutritional status, and some factors that can affect the results are pregnancy and oral birth control, and some signs of an increased level include dry mouth and skin, reduced urine output, and thirst, and some signs of a decreased level include swelling, difficulty healing wounds, and fatigue or weakness. Some implications are infections or alcoholism, and before this test you do not need to fast, and after the test you can just resume to your normal activities. Last is total protein. The normal range for this is about 15 to 60, and this test is just to measure your total protein levels. Some factors that can affect the results are drugs and burns, and some signs of an increased level include dehydration, joint pain, and fatigue, and some signs of a decreased level include swelling, muscle weakness, and weak hair or nails. Some implications are meningitis and tuberculosis, and before this test, I will need to do some patient care for a puncture wound, and after the test, I will review your results and do some follow-up care for the puncture. And that is it. Thank you.